I got asked to get involved with medical marijuana by the commissioner of the state about 4 years ago. And the research that I have done on my own with treatment of all different ailments of cannabis, all different medical problems with cannabis, I felt that that was going to be a breakthrough for pain management specialists with respect to the coming of what we see now with the opioid crisis. Unfortunately, I've had two close friends that passed away by overdosing, and it's been very difficult to see that happen. Sorry, I'm getting upset about this, but it was part of the problem was that both people had chronic pain, and they weren't getting the right care, and they were trying to find different avenues of treatment, and at that point, the aspect of cannabis came into my mind because I read about how it treats all different ailments, and that it can also lower the requirements of opioid use. But unfortunately, these two people didn't get to understand that early enough. But needless to say, in the practice that I have, and I've been practicing for almost 20 years, I have seen patients escalate to incredible levels of opioid use. And between the year 2000 and 2010, that was the decade of pain where we're being told that there's no ceiling effect, treat the patient as much as you can, don't limit the amount. And actually we got, some physicians got in trouble for prescribing not enough medication for some of these patients. And then it got to a point where we were escalating doses very high, and then things started happening to the point where patients started overdosing, not being monitored appropriately. Some of the physicians were just handing out prescriptions without monitoring their patients, doing drug screens, monitoring their other doctors prescribing it for them. And I think that's where a lot of the problem came into play. Now we've become more aware of this, and I think where cannabis fits the picture is that we've learned so much, which has been incredible, about this beautiful plant and how many things it can do for us besides treating pain. I mean, if you think about what this plant can do and how long it's been in existence, it inhibits cancer cells. I mean, this is an amazing plant. I've seen it happen. I've seen it reduce cancer in some patients that are just incredible. But they have to be caught early enough, and they have to use the right products. Patients that have Parkinson's disease, their tremors disappear. Multiple sclerosis patients, they become clearer in their minds. Their burning, shooting dysesthesias get better. The post-traumatic patients that we take care of, post-traumatic stress disorder, all their bad dreams, seem to dissipate. This plant has been a godsend to us, and I'm so glad that we are now trying to understand it much more in depth. And I think that's what's important for us to all understand is that, this plant still needs more research. And unfortunately, at this point, I don't want to get into politics, but it's still considered a Schedule I drug. And our federal government needs to be able to understand that more research is necessary. And in order for that to occur, the drug has to be decriminalized and at a lower level of category in order for us to be able to do that. So, I know I'm going off path here, but essentially, I think that this drug has been a great breakthrough for me in my practice. And anyone who is interested in prescribing it should really get involved. If there's any physicians out there, I'll be glad to discuss it with them after the talk. Sorry. So I just want to let you know I have no conflict of interest with any corporations or any dispensaries. Am I doing this right?
Not sure.
Which button am I supposed to?
Looks like this one.
Oh, that one?
Yeah.
Oh, sorry. So I'm going to try to give you a little history, a little pharmacology, go into a little bit of the species of the plants, some of the delivery systems, varieties, state of Connecticut rules and regulations, requirements, and I'll talk a little bit about using cannabis for CRPS. So as I said, the history of cannabis goes back a long, long way. Our last lecturer discussed it as well. It dates back to 12,000 years, traveled from the Asia area out west that way, and finally came to the United States. There have been a lot of people involved with getting involved with cannabis. A lot of research was done in the past, testing with animals. And then eventually in 1925, the League of Nations got involved and they banned it from the United States, and actually the UK got involved as well. From what I understand, it was a very political situation where cannabis is used to use paper products and things of that sort, and I think that's where this banning came from. That they considered marijuana as I should say cannabis, as a dangerous narcotic. It's not even a narcotic, it's a cannabinoid. In the early 1960s, there was an Israeli researcher that actually discovered the two major components of cannabis, and eventually found out that we had a endocannabinoid receptor system. So there's two major species of the plant. There's a sativa and indica. Sativa has a little higher THC concentration. Indica has a little more CBD. Sativa, and when I prescribe it, I try to tell patients that, it gives you more uplifting, more stimulation, so it's better to use during the daytime. Indica is more relaxing, more sedating, so it's better for the nighttime. Betsy Ross actually made the first flag with it, with the hemp, as we all know. And cannabis seeds actually have free polyunsaturated fats and essential fatty acids and proteins, which is actually good for you. Cannabis has a male and female plant, so it's important to understand that, and it's amazing how, if you believe in God, God made this plant have two separate sexes, so it can encourage wider genetic diversity. The female plant grows seed pods, and the male plant develops sacs full of pollen for the fertilization. And the top of the, as you saw the picture before, where the pod is, where all those pods grow together on the top of the female plant, it's called a cola. Although cannabis has been the most abused drug, when I say abused, I mean people use it for recreation. It's misleading in the respect of that terminology. You can say that things are licit or illicit, can be abused or misused. The molecules in any chemical or any drug can be either good or evil, depending on how you use it. So there's over 700 compounds of chemicals in cannabis. The two best known, as we know, are THC and CBD. To absorb these chemicals, there are different ways that we can deliver it to the body. Smoking it or vaporizing it is one way. Ingesting it using breath strips to melt in your mouth, transdermal applications, and tinctures. Smoking seems to be the quickest onset, or vaporizing. Within 6 to 10 minutes, you'll have an effect from the medication, and then last about 3 or 4 hours. Sublingually with the strips or even oils, it's not as efficient as inhaling it, but at least you do absorb it through the mucosa of your mouth as long as your mucosa is intact. And within 15 minutes, you'll have an effect from the medication and last about 4 or 5 hours. Orally, it takes a lot longer because of the first pass effect through the liver, and may take about 2 hours to absorb, but then eventually it'll last about 6 to 8 hours. Once you absorb it into your body, about 90% is then bound to proteins in our bloodstream and then distributed throughout the body. But only 1% actually gets to the brain. The liver metabolizes THC to an 11-hydroxy-THC compound, which is actually much more psychoactive. So if you are going to be using edibles, it's important to understand that. So the lowest amount of medication that you take as far as a product, the best it is, because after 2.5 hours you might regret it. Metabolites are excreted from the body in 36 to 72 hours through the urine, and the non-psychoactive metabolites can hang around for about 2 or 3 weeks. So if you have a drug test that you have to do, understand that. Numerous studies have shown different variations in people with absorption. So our endocannabinoid system is different for each individual. Some of them are upregulated, some of them are downregulated, and all depends on your body, and also depends on what medications that you do take. So there are medications that inhibit those receptors, and there's some certain medications that actually stimulate those receptors for cannabis to function in our body. The CB1 and CB2 receptors in our body are the main receptors that cannabis binds to. For this reason, it's important for us to understand the dosing. If you stimulate your receptors at low doses, you can actually stimulate the CB1 receptors and CB2 receptors to grow further. So it's important not to overdose your body with cannabis in the early stages when you use it. And eventually your body will accept that. It's important for us as physicians to understand how to prescribe this. Now, when we say prescribing, we're not really prescribing it, we're actually recommending it, because it's not legal for us to actually prescribe medical marijuana for anyone at this point, because it's still a federal Schedule I drug. But we can recommend it for different individuals, and it's important for us to look at the patient totally as an individual. Their medical history, their family history, their psychological history takes into play. So it's good to have their primary care physician to give us a little history. Whenever I see a patient, I always try to get records for the patient to evaluate them appropriately and make sure that they're a good candidate for cannabis. Some of the common side effects are tachycardia, depending on how much THC is in the product, dry mouth, dizziness, lightheadedness, irritated eyes, cough if you inhale it frequently. There is a syndrome called cannabis hyperemesis syndrome, and that can occur if you have too much THC in your body. It actually can work against you, as we know that THC does help nausea, vomiting, but too much of it can actually work against you. And of course, impaired cognitive effects, confusion, anxiety, and giving you panic attacks. On a long-term basis, if you are a smoker or a vaporizer type of user, you can develop chronic bronchitis over time. You can have some cognitive defects over a period of time, depending on how much you use and what your THC levels are. But they're usually short-lived, short-term issues that once you stop it or cut back, usually the effects cognitively will disappear. you can become dependent on it in respect to enjoying the effects of the drug. There is some literature out there that talks about some withdrawal, but the withdrawal comparatively to an opioid is minimal. The withdrawal usually lasts about maybe 2 or 3 days and then dissipates on its own. These are some of the medications that I found that might affect the oral aspect of cannabis. So if you're taking any of these medications, actually your levels will be higher. So take that into account. And it's always important to review that with your physician. And then these are some of the medications that actually inhibit cannabis from binding to the receptors. As I said, there's 2 primary receptor sites, CB1, CB2. They're throughout our body, except for the medulla. And that's why it's so safe, because it doesn't inhibit anyone from breathing at doses. Even you saw the LD50 of cannabis versus other medications. So it's a very, very safe medication. The endocannabinoids have great effects on our body, and as our last speaker spoke about it, we didn't learn about this in medical school. So my own reading about cannabis and knowing about the endocannabinoid receptors and the system was amazing. You needed to help decision-making, cognitive effects, learning, memory, body movements, anxiety, fear, pain, temperature, and appetite. These are all the things that cannabis helps stimulate or inhibit as well. These are some of the compounds that are associated with cannabinoids. There are 10 structural types. 4 of them are primary. CBN is not actually made by the plant. It's actually made after combustion, oxygenation with THC. THC, delta-9 tetrahydrocannabinoic acid, is the most common one that we have. It is the psychoactive constituent of the cannabis plant. Upon heating and cooking, vaporizing, or smoking, it converts THCA, which is the precursor, converts to THC after decarboxylation. Besides having psychoactive effects, it does have benefits. So it's a potent analgesic, it does have anti-inflammatory properties, it's neuroprotective, it reduces intraocular pressure, that's why it's good for glaucoma, and helps stop muscle spasms. CBD is the major chemical that we push for as far as pain relief is concerned, or for other aspects treating other medical conditions. It's produced by the fiber of the hemp part of the plant. CBDA is converted to CBD after heating it. CBD is also produced from CBG, but at a different mechanism. So it's another cannabinoid as well. And it exhibits analgesia, anticonvulsant activity, anti-inflammatory, and anti-tumor activity as well. Solid tumors seem to respond very well to CBD. Sativex is a combination of THC and CBD. It eliminates the unpleasant effects of the psychoactive component of THC, so, and also some of the other side effects as well. The CBD and THC, as you saw before, are interactive with each other, so one stimulates, one depresses, and it's important to have both of those components in your product. So if you're using pure CBD, you might not get the benefit fully from the chemical, because THC actually stimulates some of the receptors to let CBD bind to the CB1 and CB2 receptors. It's actually also has antibiotic properties and inhibits MRSA. Actually, in some of the studies in rats, it inhibited better than vancomycin. CBG is another cannabinoid that has no psychoactive activity. It hasn't been studied enough, and that's why the research is really important for us to be able to do this. In Italy, they had shown that it helps inflammatory bowel disease. It also inhibits pathogens such as MRSA and has anti-tumor properties. CBC is a rare phytocannabinoid produced early in the flowering cycle, so if you can get a plant that is immature, you'll have a higher level of CBC, but it doesn't bind to CB1 and CB2 receptors, but it does have other ranges of activity. And CBN, as I mentioned before, is not produced by the plant. It is found in high concentrations in some of the plants that actually are over-fermented, and actually it indicates that you have poor storage of that plant. So if you have a high CBN concentration, it's really not a good plant to use. It's actually also used in thermal sensitivity patients and burns. Excuse me. Terpenes. Now, this is a chemical that a lot of people don't talk about, but it's important to understand and know that if you're deficient in having any terpenes in your product, you're not going to get the full benefit of what a cannabis plant can do for you. The terpenes are in fruits and other plants as well. It gives it the aromatic effect, so each plant has a different aroma. So some may smell citrusy, some may smell skunky, some may smell like pepper, and others smell like lavender. But they all have activities, stimulates mood, antidepressant activities, antispasmodic, and anti-inflammatory properties. Smoking is the most common way that people will take it into their body, rapidly elevates the blood levels, peaks high quickly. You can use flour, you can use oil, you can use keef, waxes, concentrates, and hashish, which is the resin, most potent part of cannabis. This is a pretty plant here. This is a bud, and you can see the crystals around the top. That tells you that this is high, rich in CBD and THC. This is keef. Keef is the powder form of the plant. So you get a grinder and crush the buds down as fine as you can. And actually it's easier to vaporize because of the powder effect of it. And actually all the crystals are at the bottom of this, so you'll get the most out of your product by doing that. And this is hashish. So hashish actually is all the resin that's burned off and has the highest concentration of the chemicals. In California, they have all different names of cannabis, amazingly, so depending on the concentration of CBD or THC will depend on how they name them. Some paraphernalia that some places will have in the dispensaries. This is a grinder, so you put the bud in the grinder and crush it down. This is what happens when you get desperate. Sorry. Tinctures are alcohol-based solutions. So what they do is they put the plant in a absolute alcohol solution, let it sit there for about a month or two. It absorbs all the chemicals out of the plant, and then they clean out the liquid from the stems and leaves and everything. And now you have this tincture with all your cannabinoids and terpenes. These are some of the tincture products that they have available. Some of the tinctures are thin, some of the tinctures are more thick in consistency. It depends on how they make the product. They also make topical solutions. They also make sublingual strips. These are other ways that you can take it into your body. So say if you have an inflamed knee, you can rub it in. Some of the dispensaries are using cocoa butter. You can rub it into the joint. You won't have any psychoactive effects from that. It'll purely reduce the inflammation directly on the joint. The sublingual strips absorb through your mucosa of your mouth, sort of like the Listerine breath mints, and within 15 minutes you'll have an effect. The strips come in these metal containers. Just unscrew it, you break off a piece, put it in your mouth, and let it melt. And they do flavor it so it doesn't taste too much like marijuana. Oh, yes? At the dispensary. There's pharmacists at the dispensaries that will go over it with you, that will decide what products, as physicians, we give advice to the patient, and then the pharmacist will decide what products they have available to give to you. And as long as they know what your diagnosis is, which they will, because that's when we register you, your name and your diagnosis will be on the website, and then they can figure out what products will be best for your ailments. You have to go through a physician to get on the program, yes. Edibles, as I mentioned before, are good if you have time to prepare. So, for instance, if you're going to take an edible, like, say, a cookie or a gummy bear, they don't make gummy bears here, but you have to plan it so within about 2-hour period, you'll get the effect, but also make sure that you're not taking too much in, because once you absorb it, you're going to be using it through your body for the next 6 to 8 hours. So if you take too much, you might not be able to function, because, as I mentioned before, the THC component is metabolized through the liver, and it's 2 times more potent, so make sure that if you do use an edible, it's a much lower concentration. Mama Kush is just a brand that they have out west somewhere. Chips and kettle chips, kettle corn. They actually make kettle corn too. Lollipops. Not in this state, but in other states they do have suppositories. So, for instance, say if you have a chronic pain condition that's either rectally or vaginally, you can actually insert a suppository, and for patients who have like rectal cancer or vaginal cancer, and they have a lot of pain, the suppositories are great because they stay local, and the anti-inflammatory effect is, from what I read, is phenomenal. They also, out west, they have patches. We don't have the patches here yet, but the ointments we do. The typical suppository. So different varieties make different effects in patients. Everybody's receptors are different. Terpenes levels are also important, and understanding that they are a component of the cannabis plant. For instance, there's a variety of plant called OG Kush, which contains 24% THCA, 0.8% CBD, and then you have the terpenes after that. Understanding that THCA will then eventually turn into THC, so this is a high THC product, so this probably would be best for nighttime. These are some of the varieties: Sativa, Indica, and hybrids. Hybrids are a combination of Sativa and Indica plants which are fertilized together. And what's nice about that is that you can adjust your THC and CBD concentrations. Some people get very paranoid on high Sativa varieties, so a hybrid would be good for them because the Sativa concentration would be like a 60-40 variation. And these are some of the names of the varieties that are hybrids. So cannabinoids relieve neuropathic pain. That's why we're here today. In my experience with CRPS, I find that medical cannabis has been a great breakthrough for my CRPS patients for a lot of reasons. It reduces their anxiety, which is very important because, as we know, too much adrenaline flow stimulates CRPS to be aggravated. It stops muscle spasms, so a lot of people develop contractures. Cannabis helps with that. Cannabis helps with neuropathic pain in general by releasing neurotransmitters, by releasing natural endorphins, as we saw before, and reduces the wind-up phenomenon. The wind-up phenomenon essentially is centralization of the pain syndrome. So essentially, the brain and the sympathetic nervous system essentially have no control of each other, and it releases all these enkephalins and stimulates the nervous system. So as we saw before as well, the lowest dose is the best, and they found that a low THC concentration is found to be 61% successful, and even a lower dose of that is still 57% successful. This indicates small doses of cannabis can play a potential role in pain reduction in patients that have neuropathic pain. There is no FDA-approved medicine for CRPS, as we know, so we do what we need to do to help our patients as best as we could. We use off-label medications all the time to treat them. The low-dose naltrexone is not, is not truly FDA-approved for CRPS, but we use it and it works very well. In combination with cannabis and possibly ketamine, I think those three main drugs are excellent for CRPS. When you go on the website, this is what you're going to see as your first page. Our new commissioner, Michelle Siegel, is in charge of it now. She's performed a fantastic job and is a great advocate for our patients in general. This is the list of Connecticut's medical cannabis program. Debilitating, when we approve a diagnosis, the key thing is that it's a debilitating medical condition. So we have approved almost over 30 diagnoses at this point, and each one of the listed diseases is debilitating. We've also approved some of the conditions for children that have severe ailments. 18 years of age is usually the cutoff that we have, but unless you have a debilitating disorder as listed there, if you're under the age of 18, you can get it with your parents signing off on it. And that's pretty much it.